So welcome to another episode of the IAFM podcast.
I'm Paola.
And I'm Chris. And today we're here with Dr. Afshar with the Vein Institute.
Well, thank you so much, Dr. Afshar. A lot of you out there have seen recently a reel that we created when I went to visit you at your Fairfield location, which is on Black Rock Turnpike in Fairfield. So thank you so much for coming. I loved coming to visit you. It's such a clean, bright, gorgeous environment that you've established there. And you have a wonderful staff. So I just want to start off by saying what a wonderful facility you have. I loved it.
And I apologize that Paola didn't invite me.
Shut up.
We're working on that.
Well, good morning to you both. Thank you for having me. It's a pleasure being here.
Thank you so much. So Dr. Afshar, first things first, we just wanted to kind of get your background a little bit, learn more about you. Did you always know that this was a field you wanted to get into when it came to like vascular health and stuff like that?
No, not necessarily. My background was mostly in research on immunotherapy and specifically melanoma. So that's kind of what my background was at the National Cancer Institute, where one of the projects that we were working on was actually cutting the blood supply to tumor cells. And we chose melanoma because it's visible. So, it's easy to see the regression or advancement of the disease. So then, vascular part of medicine kind of interested me, and I saw that there was a great need for treating venous disease, which we will talk about further, in an environment and a country where over 40 million people are affected, and almost 1 in 4 people have some sort of a vein disease in the country. So there was this very high need. As in the past, the treatments were quite barbaric. So as physicians, we used to kind of recommend more conservative management than surgery. But now it's kind of in and out of office with great results and minimal side effects, if any.
Yeah, that was one of the things that really stayed with me after our visit was how I know the checkup that like I had, I was just having something checked on my leg, but like even that, like the process of the checkup and even like the conversations afterward, it was a very gentle type of checkup. It wasn't invasive at all. And what I like too is your knowledge and the background that you had and the time that you took to really stop and evaluate and explain how the system works and what is, how our blood flows throughout our body, how, this particular part of your body is doing this or that, and how some of my personal concerns weren't even vascular concerns at all, right? They were more like, I think it was in like the neurological, it was like, It was so nice and so comforting to know that I was speaking to someone who really had a strong background and strong knowledge on what's happening in our bodies. Mm-hmm. And to know that you have control and you can actually find the right solution for what's going on. And why do you think, when it comes to vascular health, I mean, I feel like a lot of times the first thing that comes up is like
varicose
veins.
Like as like a Gen Xer, and like I remember even as a kid, like my mom always talking about varicose veins on her legs. So that's the only thing that popped into my head. But when Paola got back from meeting with you all, she kind of told me that there's a lot more to it, which I thought was pretty awesome because, we as people who are not living in that world, we're ignorant to it.
Yep.
Yeah. So, I mean, your legs are important, right? Yeah, they kind of take you everywhere, so you need them. And the healthy legs are, unhealthy legs, before they show anything, they become uncomfortable. But the uncomfortableness and the symptoms of leg veins and leg health are quite subtle. So we kind of tend to, as a general population, we tend to contribute it to, oh, well, I've been standing all day, or I have been on my feet all day, or I haven't slept, or I'm always tired, and things like that. But the fact of the matter is that leg health can easily be turned around to the point where you can have more energy, you feel less tired, you feel less fatigued, you don't get as much cramping. It's rather important, and even more important is the fact that it can get treated nowadays in a very, very simple format.
Yeah. Yeah.
I have a kind of a random question that popped in my head, and it's probably a dumb question, but do like the sneakers or shoes you wear play a role in vascular health?
Yeah, they absolutely do. And as a female, notice when you wear high heel shoes, it can affect your circulation, but you can't tell people not to wear. You can't tell women not to wear high heel shoes, right? It's part of their beauty.
So did I.
So we try not to say that. Don't wear high heel shoes anymore. Yes, it does. It does. So the more comfortable your shoes are, the more cushion you have, the less pressure on your legs. Yes.
So with varicose veins, obviously that tends to be kind of more of like the buzzword when it comes to vascular health. Like what exactly, like I just know varicose veins and I know kind of what they look like, but what exactly is that?
Well, the vasculature in the legs is actually three forms. One is the arterial system, which has nothing, I can't say has nothing, but it's not related to vein disease. The other is the lymphatic system, which collects all the waste from all the chemical reactions that happen in your system, in your legs. And then you have the venous system. So, varicose veins are branches that come off of a truncal vein. So if you think of it as a tree, the first branches that come off of the trunk of the tree become varicose, where the actual etiology or the cause of your varicose veins are abnormal one-way valves that are incompetent, and they do not allow you to send all the blood towards your heart. Some of it gets sucked back down by gravity, dumping back into the branches that were draining into that trunk in the first place, making them bulge and making them varicose and ropey and tender sometimes. Yeah.
So when you treat them, are you healing them and making them work better or correctly, or are they always going to kind of give you that trouble?
Venous disease is a chronic condition. So a definition of a chronic condition means there is no cure, but there is treatment, just like diabetes, like hypertension. There is no cure for them, but we can treat them for patients to have a normal life. So when it comes to veins, in the past the medical community did a lot of research on repairing those one-way valves, but that is was found to be not only not very effective but also unnecessary. So what we do now, if we have a truncal vein that has incompetent one-way valves, and some of the blood that's supposed to go all back to the heart gets sucked back down by gravity, we just close that section shut. And it's done by some sort of thermal energy, whether it's radio frequency or laser, or even there is a type of glue that you can use. And that's pretty much like closing an exit off of a highway. So the exits above and the exits below take over. And if you ever need a new exit or a new vein, you can always make one, but it's most of the time not necessary because, veins, one of their major functions is to store blood. So as we are all sitting here talking, about 60 to 65% of our blood volume is stored in our veins. So we have plenty of room to do that.
Oh, good.
Oh, that's interesting.
Yeah, when it comes to arterial, you more have to graft a piece of vein and replace that artery. But when it comes to veins, you can just remove them.
Okay.
That's incredible. Are there I'm sorry, I keep you want to ask something.
No, I would just, is varicose, I mean, obviously varicose veins is very common in women. Is it common in men as well?
Oh, absolutely. It actually affects about 22 million women and about 11 million men between the ages of 40 and 80.
Wow.
So more common in women, absolutely.
Yeah. But it's
those
funny.
high heels.
It's those high heels. Forget the high heels, ladies.
Yeah, we'll get back to that one.
It's true though. Like I feel like you just associate it with women and wanting to treat but you don't really always think about men, that they're also having to deal with these things. So Dr. Afshar, outside of the obviously, well, not obviously, a lot of times we can visually identify having this issue with varicose veins, but are there other symptoms? Are there maybe internal, more pain related or other things that people can be watching out for, to be like, hey, something is not quite right, maybe I should get this checked out? It could be the beginning of something.
That is that's a great question. Yes, and the answer to that is yes. So what we do have when it comes to vein disease or any other disease is we have signs, is what you see on the surface, and then we have symptoms, is what you feel. So the signs of venous disease, if you see on your leg, it could be as simple as seeing some varicose veins on your legs, or some even spider veins on the legs. Some people present with skin discoloration right above the ankle. And this very common in nursing homes. If you go to nursing homes, you see that a lot of nursing home residents have discoloration above their ankles where the skin is darker and more leather-like. That's a sign of vein disease. Obviously, if you have an ulcer, but then more importantly is the symptoms of vein disease that kind of creep up on us over time. And because of that, we kind of contribute those symptoms to just feeling tired, or the job we do, or the shoes we wear, or so those symptoms are, and we hear it most often in teachers, nurses, retail workers, people who stand most of the day.
Hospitality as well, I imagine. People like servers and bartenders and stuff.
Correct. Anybody who has, even surgeons. So the symptoms that kind of creep up, and they can be subtle at times, is that your legs feel tired. So you feel tired as a whole. Your legs feel achy. You have leg pain. You get swelling at the end of the day. You have itchiness. There is, legs feel heavy. That's one of the areas when people kind of notice how heavy their legs felt after the treatment. Suddenly after the treatment, legs feel lighter. They have more energy. So you have that heaviness, you have varicose veins, you have skin changes we talked about. And, men usually present later than women. So in men, we tend to see more ankle ulcers, which are called venous stasis ulcers. Venous blood being static also.
What is the symptom for that in men in their ankles? Like what would like what should a man look out for if that? Yeah.
Yeah, so around your ankles, most commonly on the inside of the ankle, you see. I know now we're all looking at our ankles. It's good. Keep checking. Yeah, so the ankle ulcers, you start seeing a small scab inside of your ankle, kind of around the malleolus where there's not much room or meat. And then that scab does not really heal after a while. And then over time, it starts to get bigger.
Oh, okay.
So that's what you have to look at.
With leg health, I mean, obviously leg health is important, but if you neglect leg health and your vascular health, what could that lead into other things from a health perspective?
Yeah, absolutely. So leaving it alone kind of leads to things that become more difficult to treat later on.
Sure. Gotcha.
Just like any chronic condition, just like diabetes, just like hypertension, like heart disease, any chronic condition, the sooner we address it, the better off we are in the long run.
Sure.
You start getting things like swelling. Ankle swelling is quite disturbing, believe it or not. It's
for sure.
You can't put your shoes on. You can't. You just have these thick ankles, and they can hurt. They get puffy, and then you wear shoes, and then one part is puffy, one part is drained. And
describing my feet.
Right. Yeah. So that's one scenario. The other scenario is that increases your chances of blood clots because you have blood pooling in your legs, and you never want static blood anywhere in your system. Blood is something that has to be moving, and also ankle ulcers, as we talked about.
So do you work and I only ask this because my father's a diabetic. Do you work with, because immediately I'm like, oh, maybe I should have my dad come and see you. Do you work with a lot of diabetic patients? Because I know that is really, really important. Like my father gets, from a podiatrist perspective, like he gets, we have a nurse come once a week to take a look at his nails and legs and all that stuff.
That's an excellent question. But diabetes mostly affects the arterial system. So there is narrowing of blood supply to your peripheral organs, your feet being the furthest away. So arterial system becomes narrow and the blood supply decreases. So you start kind of, if you don't address it, or if, like your father, you're not checked by a podiatrist at least once a year, then you could start getting wounds that you don't realize you have, and they become infected. So we do assess arterial blood flow by certain tests like ankle brachial index, or by an arterial versus venous ultrasound. And then we kind of direct them in the right direction, so to speak. But diabetics usually get arterial narrowing versus venous disease.
Got it. And you had also mentioned, I know you talked a lot about people who work on their feet for prolonged periods of time. Do you find that also people who sit for prolonged periods of time due to their work, do they find, like, does that cause or could cause some vascular issues as well?
Yes, it can. Sitting is kind of similar to standing when it comes to vein condition. So the only way to really improve your vein health is calf movement, and that's why walking prevents blood clots, because your vasculature, especially your venous system, depends on your calf muscles to move blood. So it's not uncommon for us to call your calf muscles your second heart. Because it kind of helps with the circulation. So when you're sitting, you're not doing that. So if you kind of just push your foot up and down, like pressing the gas pedal in the car, that causes calf movements. And that's good for when you're sitting for long periods of time.
Got it. Oh my gosh. So I need to walk the dogs a lot.
A lot.
What you're saying.
A lot.
What about like even putting like a tennis ball underneath your foot and like just rolling it around? Is that helpful as well?
No, not really, because that is used for fasciitis.
Yep.
When you have inflammation of the padding under your foot, when it becomes inflamed, it becomes that the bottom of the foot becomes very painful, especially when you first wake up in the morning, and then it gets better over time.
Yep.
But that's to massage the fascia under the foot.
Gotcha.
More
Okay.
than vein health. Yeah.
I'd love for you, because obviously I didn't go with Paula when she met with you. I would love if you wouldn't mind just kind of walking us through like what a procedure would look like,
Procedure is minimally invasive, if invasive at all. It's a little bit more invasive than giving blood really nowadays. The patients coming, not much pre-op preparation required except hydration. They come in, we kind of prep the leg under sterile fashion, and we gain access into the vein that's incompetent under ultrasound guidance.
Yep.
And through a series of maneuvers, we inserted very, very small catheter into the diseased vein.
Mm-hmm.
Okay.
The catheter emits thermal energy. So we localize the area where the catheter is in with local anesthesia only, nothing more needed. And the thermal energy of the radio frequency generator or laser generator collapses the incompetent vein shut.
Right.
We put a Band-Aid where we access the vein. We put your compression stockings on, which you wear for about a week, and that's the treatment.
That's incredible. And you said it's pretty much painless, and you can go back to whatever you were doing that day. You don't have to go home and put your foot up or.
Absolutely not. Absolutely not. Whenever you manipulate veins, because it's a very, very slow moving system. Your normal blood pressure, a normal person would be, let's say, 120/80. The blood pressure in your veins is in single digits. So it's a very, very low pressure system. So we don't want you to sit after a procedure. We want you to actually go for a walk.
Oh, okay.
Good.
That's really good to know.
And you mentioned the compression socks.
Yes.
That's part of like the recovery part. But I also know people who have this as part of their regular day-to-day stuff, like people who like work out a lot, or like I've heard of like when you go on an airplane, because there's the pressurization and like the swelling that can happen. Mm-hmm. People wear them when they travel all the time. So how important are compression socks, obviously for the recovery, but like, is it something you use on a day-to-day basis all the time, or certain situations?
Compression stockings are kind of hit or miss in terms of whether you're comfortable in them or not. So that's the hardest part of compression stockings. Otherwise, whether you have vein condition or not, having extra compression in your calf to help your calf pump, the muscle pump in your calves is always helpful. They're actually called gradient compression stockings because they're tighter around your ankle, and the tightness decreases as you move up towards the knee. So it promotes blood flow going up and prevents pooling of blood towards your feet.
Okay.
So on the plane, long car rides, anywhere that you may be standing for long periods of time,
Got
like
it.
in a line in a post office.
DMV.
That's so true. That's awesome. So, okay, so compression socks. So I know we've been talking a lot about the varicose veins.
Yep.
But another thing, and I told Chris as soon as I got home, like, you're not going to believe the amount of stuff that they treat. Like, when I heard of Vein Institute, or really like when you think of any sort of like vein, like I speak for myself. I think varicose veins. But what was really impressive to me, and what I thought was so important to share with people out there, was the amount of things, of diseases or conditions that you treat at a Vein Institute. We talked spider veins, hand veins. I didn't even think like, is that just, I don't know if that's something that's just, aesthetic, or if that's actually something that could lead to something more serious. But there's like hand vein treatment, facial veins. Ladies, there's vaginal vein. It's okay, we can talk about it. Nothing to be ashamed of. Restless leg syndrome, radio frequency ablation. I don't even know what that is. Ambulatory phlebectomy, sclerotherapy, and the one that I was like, okay, people, let's talk about it. Hemorrhoid treatments. Like,
yeah, that's not talked about as often as
common.
Totally common.
It's common. They can be painful. Like, and that this is somewhere that you can actually treat it and help your situation. So I think it's so important for people to know that there's somewhere they can go and safely and comfortably, and with like little to no pain, or no pain, you tell me, like, treat these conditions that can feel obviously very personal, and some people don't even want to discuss it. Some people might be even afraid to go to you or anyone to even talk to a doctor about it because they feel embarrassed about it, but you shouldn't. And I just want them to know there's somewhere for them to go,
Yes, absolutely. When it comes to leg veins, which we have been talking about, you are really you are treating a tree. Right. So when you start with the trunk, the best modality, because it's straight, you just insert a catheter into the trunk, you treat the trunk. When it comes to the first branches, which are varicose veins, there are a couple of ways to treat it, but one of the oldest and still most effective ways to treat varicose veins is simply remove them under local anesthesia. That gives you immediate relief, and within 3 days, you open the bandage and there is nothing there. So that's by far the best modality. And then you have the spider veins, which you cannot negotiate any kind of laser or radio frequency catheter through, nor can they be removed. So you have to you inject one branch that feeds a lot of spider veins, and the solution that you inject, which is a detergent, is a medical grade soap, it travels into those branches. So that's how you've treated from the trunk all the way to the end branches.
Okay. That makes sense.
When it comes to restless leg syndrome, there are two major causes that we know of. One is if you have low normal or low iron levels in your system. So if your blood work is completely normal, but your iron level is also normal, but on the lower end of normal, if you increase iron intake in your diet, that tends to improve restless leg syndrome. But we mustn't confuse restless leg syndrome with cramping at night. Restless leg syndrome, you actually need to get up and walk to get relief. Cramping, nighttime cramping, we really don't know what causes it. But restless leg syndrome can easily be treated. And then the other treatment for it is the vein disease or vein condition, which once the vein condition is treated, and the iron levels increase in your system, restless leg improves.
That is so good to know.
That's really good
That
to
is
know.
really good to know.
When it comes to
Great, yeah.
Hemorrhoids, come in two flavors, right? You have external hemorrhoids that can be inflamed and painful, and you have internal hemorrhoids that are often not painful, even though they can be, but they're usually not. But you do bleed. You have spotting in the bathroom,
Sure.
and again, inside of your rectum is more like the inside of your lip, so there is no skin, so it's very susceptible to any kind of light, like infrared light, and those are veins too. When you go to the bathroom, enormous amount of pressure on your pelvis to have a bowel movement, and those veins get engorged, and then the stool scrapes off the vein and you bleed. Easily treated with infrared light, no pain, no time off. Post-op pain is the most important thing for our listeners to know, because hemorrhoids are, when you think hemorrhoids, you think pain.
Yeah.
And they can be painful simply because, around your rectum, you have as many nerve fibers as you have on the tip of your fingers. So any small thing, you feel it quite a lot.
Right.
So that's easily treated. But of course, any kind of rectal bleeding, if you haven't had a colonoscopy, you have to schedule one, just to be sure that it's not coming from anywhere higher up.
Right. So that's step one. It's just doing the checkups you should be doing.
Come for your evaluation and get and schedule a colonoscopy, but we'll evaluate you for internal hemorrhoids also.
Okay. Sounds good.
Hand veins are, yes, all aesthetic.
All aesthetic.
So all we have to do is just shrink those veins down, and they become smaller. No change in your no change in circulation of your hands, and also in between the knuckles we can inject some fillers to kind of puff up the hand. So that's all cosmetic. Yes.
Is that almost like using like Botox? Maybe even
it's more like spider vein treatment.
More like spider vein treatments. Okay. So yeah, solutions to everything. I like it. I like it. And what did I want to ask you too? Oh, and if you're comfortable, like what are vaginal veins? Like what kind of issues can women have that, and how do you even know you have it?
Yes.
Waiting for this.
Yes. Oh, you would definitely know you have it. Exactly.
Our dogs are going crazy.
Run away.
I want to know.
Run away. So, during pregnancy, during childbirth, and during menstrual cycle, the blood supply in the pelvic region increases dramatically. For obvious reasons, right? You need more blood supply.
Yeah.
So just like you will have on your legs, you'll have engorged pooling of blood in veins on the vaginal area that become uncomfortable, that become painful, and it's more discomfort than flank pain. And they are usually, we have one of our scleral nurses inject them and keep them compressed for a day or two. Excellent results.
Awesome.
Excellent results.
Awesome. That's so good to know. I mean, we have a lot of moms out there, a lot of women out there.
Yes.
Like, pay attention to your body, I guess, is the biggest message. Like, let's pay attention to how we're feeling. Let's not be afraid to ask questions.
Absolutely.
I love that. Dr. Afshar, I also want to make sure people know in Fairfield County that your location, I know I went to the Fairfield location on Black Rock Turnpike, but you have multiple locations.
Yes.
So all over Fairfield County. So where else can people find you?
We have locations in Newtown, Fairfield, Shelton, and Milford currently.
Beautiful.
So, from the southern Fairfield County all the way up.
Amazing. I love it. So people, you have, and when we post this out, we'll put all the phone numbers, all the addresses, so you know exactly where you can go. Our dogs are joining us now. Exactly where you can go to find Dr. Afshar or one of his amazing staff to assist you with any of your questions. Is there anything else that you would like to share? Like what I could tell, to be very honest, and I know that everyone watching this now, I hope you can really see exactly what I saw, because I immediately felt very welcomed by you and your staff. You are so easy to talk to. It is so very, just like, it's just comfortable. And
you were like supercharged when you came home. She was like really stoked on
because of all the chocolates you had.
Yeah, I have so are Charlie horses related to veins, out of curiosity?
They can be. Yes, they can be. They can be. When you have cramping during the day, not at night.
Yep.
When you have cramping during the day, of course, the first thing we all think about is hydration. Very important. And then there are other things that are important for muscle health, like magnesium, like potassium, things like that. So as long as you have a balanced diet, and you hydrate well, the next thing you have to do is, diagnosing vein disease. I wish all diseases could be diagnosed so easily. It's just non-invasive, no radiation, relatively inexpensive, with a ton of information, duplex ultrasound of your legs. Everybody's had one here or there, and everybody knows what it is. And it is just, it's a magnificent tool for physicians to confirm the diagnosis. But yes, Charlie horses can be veins. Yes.
So this is just a no-brainer to definitely keep up with your vein health, know what's going on. And as we've kind of learned, especially with, in regards to the hemorrhoids and understanding the external versus internal, I think is really, that was a really great information, because people don't realize that, or it's like they're just not common to it. Sorry about that.
Sorry, Mike.
Yeah, absolutely. And the other thing I think that's important for our listeners to know is that vein disease is not a cosmetic problem, and it's covered by insurance.
Yes, that was my last question.
That's right.
I jumped ahead.
No.
So you covered.
So important, you guys, because I can't even tell you, like, it's in many different fields, right? Even like sometimes dentistry, right? Like it's limited to what kind of insurance can cover certain.
Yeah, for good or for bad, people make decisions based on, whether or not their insurance is going to cover it. And
yes, of course,
all insurances, including Medicaid and Medicare.
Yes.
That's important.
Because it is a medical condition. This is not solely a cosmetic condition.
Yeah.
Excuse me. Especially if you have varicose veins. Now, spider veins, it can be just cosmetic, but you wouldn't know that without doing an ultrasound.
Without really looking into it. Exactly. So
no, but
people
it's important to highlight, because like we've been in the situations like over the years where, based on the insurance that we had, we made our decision based on, will the insurance cover it or not.
Of course.
But
terrible to be in that position.
It's a conversation for another day.
Absolutely. Oh yeah, that would be a long one.
It would be a long one.
I know. Well, this is fantastic. Everyone, if you want some more information, and again, we will post all of this and back it up for you, but
for sure. And link it out and everything.
Link it out, VeinInstitute.com. Again, Dr. Afshar has locations in Fairfield, Newtown, Shelton, and Milford. And you can just,
or you could even call, which we'll throw
we'll throw the numbers out there as well.
Just put it like right there.
You can make appointments online right on our website.
It's been better.
And we also always have a 24, we have a 24/7 live agent on the website that you can ask questions and make appointments. So
you have it covered, Dr. Afshar. I love you.
So, Dr. Afshar,
thank you. Thank you so much. You're so sweet. Thank you.
On our podcast, we love to ask too, completely unrelated to work and everything. Is there any like shows that you love watching or any books that you like to recommend to people? Things like anything like that. Not to put you on the spot. You don't have to answer, but we always like to.
I don't know. With me, somehow I start a show.
Yeah.
And then, it takes me a year and a half to finish I'm not good at binge watching. So